Hi, what I wanted to do today is give a general introduction to sustainability in dentistry. My name is Brett Duane and I work at the Dublin Dental School and Hospital, which is part of Trinity College Dublin. Over the past few years, I've worked for Public Health England and NHS Fife in Scotland. This presentation relates to the work that I've carried out in all three organisations, and a lot of the work has been undertaken in collaboration with the Centre for Sustainable Healthcare. So what are the objectives of this presentation today? I want to explain what I think sustainability involves. I want to talk about the legal reasons we need to reduce our carbon, understand what we mean by the term carbon footprint, talk about how the Centre for Sustainable Healthcare and myself calculated a dental footprint for NHS England, and understand what makes up this dental carbon footprint. And finally, we're going to talk about how dentistry could possibly reduce its carbon footprint. So what is sustainability? The simplest definition that I can find is that sustainability means meeting our own needs without compromising the ability of future generations to meet their own needs. So everything we do, we need to ask ourselves, does this action compromise the ability of future generations? And I think sustainability is really, really broad. And when I was thinking, how do I explain what I think of sustainability? I had a whole lot of things I could talk about. We know bees are disappearing. We've seen recently how much plastic is being washed up on remote Pacific islands, how much plastic is starting to get into our ecosystem. We all know that species are declining. We all know that air quality is poor. And we all know, of course, that with global warming, we've got sea level rise, and this has had a significant population impact. So sustainability is really, really broad. From a European law perspective, and this video is made in Ireland, but also I have a strong working relationship with the Centre for Sustainable Healthcare, so I wanted to talk about both European law and with it Irish law and UK law. Basically, in European law, we have 2030 Climate and Energy Framework, and that was agreed in October 2014. And it's committed to every EU member state to a 40% reduction in greenhouse gas emissions relative to 1990. And if you look at Irish law and UK law, both countries have produced climate legislation to facilitate these kind of reductions. So we've got the Climate Action and Low Carbon Development Act in Ireland in 2015. And in the UK, we've got the Climate Change Act 2008. And again, these are about facilitating the EU mandate to reduce carbon emissions. What I also wanted to briefly touch on was the 2030 Agenda for Sustainable Development from the United Nations, and a recent piece of work that's been adopted by the World Dental Federation. So the United Nations have 17 sustainable development goals relating to sustainability. 11 relates to sustainable cities and communities. 13 relates to climate change. 7 relates to affordable and clean energy. A lot of the things that we need to do in dentistry are covered by these 17 United Nations Sustainable Development Goals. So I wanted to talk about why sustainability is important in healthcare. Healthcare in the UK, healthcare in Ireland, healthcare everywhere is a huge business. The NHS is one of the biggest organisations in the UK. Not only does it employ people, it purchases a number of products. It purchases pharmaceutical products, which have a really high carbon footprint. Patients travel to come to its services. Staff travel to see patients. The things that we do have a positive impact on patients' health. But unfortunately, just by operating a healthcare system, we are also producing carbon dioxide equivalent emissions. And these carbon dioxide equivalent emissions are unfortunately impacting on the health of our population because of their detrimental impact. So as healthcare providers, we need to make sure that we are providing the best service for our patients, but ensure that our healthcare systems are also sustainable and have the lowest carbon footprint possible. This presentation focuses on dentistry, and we look at how dentistry is adding to the carbon footprint and how we can consider as dentistry how we can reduce that carbon footprint and still maintain high quality patient care. Recently, and I think this is quite exciting, the World Dental Federation adopted a whole lot of principles, and they're urging all national dental organisations to adopt these policies. So some of the things they've talked about are preventing oral diseases and promoting health. We know that preventing disease significantly reduces the dental carbon footprint of an organisation. The dentist should take steps to educate all of the dental team. Wherever possible, dentistry should reduce the consumption of basically everything we use. So energy, water, paper, the things that we buy. Dentists should consider the environment when deciding to use a single-use, disposable, reusable product. And that's quite difficult because we're not entirely sure at this stage what's best for the environment. The dental industry needs to engage, and they have started to engage, and they need to apply the principles of sustainability to dental product life cycles. Dental manufacturers need to be encouraged to develop more sustainable dental materials and technologies. We've talked about national authorities, but we've really just spoken about national dental organizations. What we also need is national authorities, research organizations, etc., to stimulate research sustainability in order for us to understand how the things that we do in dentistry impact on the environment. In the UK, they have a sustainable healthcare strategy. So the NHS, the social care system, the local government and Public Health England have a healthcare strategy based on 3 principles. They believe that a healthy society depends on a healthy environment. The health and care system is increasingly aware of the benefit of helping to develop resilient communities. And again, like the FDI, the health and care system should take every opportunity to work with people to prevent the preventable. And in Ireland, more recently, in fact only last year, we have a sustainability strategy for health. So everybody is looking at their health systems and trying to work out how we can make our health systems more sustainable. So what do we understand by the term carbon footprint? Basically, carbon footprint is the sum of direct and indirect greenhouse gas emissions. These can be produced throughout the supply chain of activities, and they're expressed in carbon dioxide equivalents. So it's not just carbon dioxide we're talking about. It can also be nitrous oxide, for example. It can be methane, for example. But these are all expressed in carbon dioxide equivalents. And that's basically so that we can compare like with like. So why is the carbon footprint so important? Basically, it's one of the most common measures of the effect of an individual, community, industry, country, healthcare system on the environment. And also, an increase in greenhouse gas emissions, and therefore the carbon footprint, is the primary event associated with climate change that has led to global warming. So all those things we were talking about before, sea level rises, the impact on population, this is all related to our carbon footprint. So why do we measure carbon? There is a number of us working in sustainable healthcare, and we believe carbon will be in the future as important as money. We believe that carbon emissions need to be calculated and tracked, and every policy development within a healthcare needs to have a carbon dioxide emission quantity associated with it. Because without measuring carbon dioxide, and once we know our carbon dioxide emissions, we can then consider how service redesign impacts on our carbon emissions, or we can look at service redesign to reduce our carbon emissions. By knowing carbon dioxide emissions, for example, of a box of gloves, we can compare it with another box of gloves and determine which box of gloves we wish to purchase in order to reduce our carbon emissions associated with a box of gloves. So it basically enables us to compare higher and lower carbon interventions and products. And it enables us to engage the public, staff, suppliers and providers and all work together to reduce the amount of carbon dioxide emissions that we're producing. So how are we doing in the NHS? Basically, we're not doing as well as we could be doing. You can see the trajectory that we have to meet the Climate Change Act. That's the orange line moving down to 2050. And you can see the current system, which is in blue. So there's something there that you can see, which is the trajectory wedge, where we're not reducing our carbon dioxide emissions enough to comply with the Climate Change Act. How do we calculate it? Well, basically in any carbon footprint, there are 3 types of emissions. There's Scope 1, there's Scope 2, and there's Scope 3. Scope 1 is all the direct things that an organization produces. So the energy it generates, the vehicle emissions, the nitrous oxide, etc. So in dentistry, we don't have a huge amount of direct emissions. We produce some nitrous oxide. Some organizations will be producing energy, but most of our carbon emissions come from Scope 2 and Scope 3. Our Scope 2 emissions, for example, are indirect emissions. So electricity. The electricity that we're using, we need to consider the carbon dioxide equivalent emissions that we use to produce that electricity. When we're talking about scope 3, these are other indirect emissions. And then we're talking about travel, waste disposal, and the whole supply chain. So most of dentistry, our carbon footprint is scope 2 and scope 3. So the NHS carbon footprint breakdown generally, and this is for NHS England, is displayed here. And you can see that 61% of the carbon footprint is procurement. So that comes from the things that NHS England is buying. 13% comes from travel. 17% comes from the energy used within building. And 9% comes from the materials that we commission.
Hi, my name is Darshini Ramasuvu. I'm a scholar in sustainable dentistry, working with Brett, the team at the Centre for Sustainable Healthcare and Health Education England. I'm going to talk to you a little bit about calculating the carbon footprint of the more commonly performed procedures within NHS dentistry. The dental procedures which were included in this study, which was published in the British Dental Journal in 2017, included examinations, scale and polishes, fluoride varnish and fissure sealants, endodontic treatments, restorations ranging from amalgam, composite, glass ionomer, crowns, dentures, nitrous oxide and study models. This flow diagram is for amalgam restorations. It shows how we calculated the inputs. So firstly, we went through every stage of the restoration, starting with preparing the patient, local anaesthetic, the drilling, lining the tooth with something like glass ionomer, mixing the amalgam, filling the tooth, rinsing, and then the sterilisation of the equipment subsequently, and the disposal of the amalgam that was left over. From this flow diagram, we were able to calculate and look at inputs including travel, the generic disposable items, so gloves, masks, tissues, our reusable tools, our mirror, our tweezers, the equipment we used, 3-in-1, suction, light cure, and the more specific items for amalgam restoration, so the amalgam itself, lining material, and local anaesthetic. Here's our process map for dental amalgam, so looking at kind of the material components, the energy, and then the disposal in terms of when the restoration is placed, so our capsule disposal, production waste, and then obviously after the restoration is placed in the tooth where it kind of ends up subsequently. This is the process map for dental amalgam, showing us the materials that it's composed of, how we mix it, store it, place it in the tooth, and our overall kind of production waste. The next slide looks at our inventory of resource use. So our human resources time, our generic disposable materials used for the procedure, so things like masks or gloves, the mouthwash of the patient, our reusable tools, our examination kits, our probe and our mirrors, our electrical equipment and their associated energy consumption, and also our very specific materials, so for restoration, local anaesthetic. What we included in the study were emissions associated with travel, commuting, procurement, energy, water, waste and nitrous oxide, but what we excluded were greenhouse gas emissions associated with capital items. In terms of the carbon emission related to the procedures, for patient travel we looked at the number of visits, the number of times that they came to the clinic. For staff travel, administrative procurement, our materials. The main data sources we used for this study included data from the data warehouse of the NHS Business Authority, a paper by Dr. Brett Duane, Carbon Footprinting in Flight, information from the National Association of Specialist Dental Accountants, and lastly for nitrous oxide, information from the Information Service Division in Scotland. I'd like you to take a moment and think about which procedure overall was the most carbon intensive, and then which cumulated dental procedure generated the most carbon emissions in total or overall. So here we have the result, and we can see that the procedures that generated the most carbon emissions were those associated with multiple visits and laboratory fees for our dentures, acrylic and metal, and our crowns. In terms of the cumulative procedure, examinations accounted for 41% in terms of our volume of activity. So where does most of the carbon come from? Is it energy? Is it procurement? Is it patient travel? Is it staff travel? The results of the study concluded that really travel overall, so patient travel, staff travel for work and staff commuting, accounted for a really significant proportion of the overall admissions, with procurement coming in secondary. This is different than other areas of healthcare and their carbon footprints, which makes dentistry a little bit unique. In terms of procurement, we can break it down even further into our administrative expenses, our laboratory fees and our materials, and these three components were fairly equal in terms of the carbon footprint and the emissions overall.
Hello, my name's Sarah Harford and I'm going to be talking you through the remainder of our presentation. I'm a practicing dentist based in community and hospital dental services, but I've also got an interest in dental public health, and I'm currently a Sustainability Fellow for the Centre for Sustainable Healthcare, and I work with Brett and Darshini. So what can we do to reduce our carbon emissions? Firstly, we have to have an understanding of where they come from, and as our study showed of the total annual carbon footprint of dental services in England, there are multiple contributors to it. And perhaps surprisingly, what our study found was that patient travel, staff commuting and staff travel for work were the highest contributors. However, this is only one of very few studies in the area, and further research and guidance for our profession is really needed. Research institutions, UK and Ireland, Europe-wide and globally, need to carry out research into standardising carbon modelling, so healthcare services can easily measure their own carbon footprints and see the impact of changes that they may make if they want to become more sustainable. We would also benefit from research into how sustainability can affect cost, so whether there is also a cost benefit in making sustainable changes, which would have a very positive impact and also influence on the profession as a whole. So economic analysis of sustainable changes to see if there is a two-way benefit, not only in reduction of carbon, but also in the reduction of money spent, is necessary. Money is more tangible than carbon emissions, and seeing figures and facts may, for some people, be more persuasive and influential in order to drive that change that we need to reduce our carbon output. So what can dental professionals do in general to start becoming more sustainable? Although currently there are limited resources and more would be much appreciated and hopefully will be developed in the future, one such resource with some guidance for dental professionals is the Green Impact Tool Audit, which is available online and is hosted by the National Union of Students. It's a guide for anyone in a dental practice to make sustainable changes, whether simple or more complex, that they can choose from, and resources are available to help them through that, as well as useful examples. Dental professionals can also join a network called SUSNet. It's a great resource hosted by the Centre for Sustainable Healthcare, where discussions, blogs and other resources are available. So as we have seen in our study, the highest contributor to the dental carbon footprint of a dental service is travel. That's patient and staff travel. So practices could start making simple changes to improve this. One way is to think about the service and to consider a service reconfiguration. So looking at appointment times and frequencies. If a patient has to come multiple times, that means multiple episodes of travel to the practice. For example, increasing an appointment time to deliver as much as possible during an appointment would be beneficial, if possible. And also looking at recall intervals, so making sure that patients are recalled to the practice enough for their need, but also making sure that it's not too frequent. A practice can encourage their staff and patients to use other and more sustainable methods of travel, for example, walking, cycling, public transport, carpooling, and along with that, making resources available for them to easily do so, such as installing bike racks or providing shower facilities or signing up to the Cycle for Work scheme with the government to help staff get bicycles in order to come to work more cost effectively. Informing patients and staff of their travel and of the options is also important, so displaying that in the practice or on a practice website. It would also be very useful for the practice to carry out an audit of how their staff and patients come to the practice currently, to get an idea of how many people come by car or use public transport and whether that can be improved, and then make changes and potentially re-audit then again. Procurement is another way that dental practices can make some sustainable changes. So this is in the way that they buy their goods and services. So if a practice hasn't already, looking at how much they spend on their products each month, for example, and making sure that the right amount and only the amount that's needed is bought to avoid waste. They can also liaise with their manufacturers and with their suppliers to make sure that the products they're buying are sustainable or potentially have recycling packages, or that they are sourced sustainably. And they can inquire as to if other alternatives are available if their current products aren't sustainable. Larger corporates should also prioritise sustainability, so when they're tendering with suppliers, making sure that carbon reduction is a priority and sustainable statements are used. Working with the providers of education is invaluable to increasing the understanding and awareness of the dental health profession. So work needs to be done with commissioners of dental services in order for them to better understand what sustainability is, where carbon emissions come from, how to calculate them, and how they impact on this healthcare service and on the environment. Improving the understanding of healthcare providers themselves, so for us dentists and dental care professionals locally, can have a huge impact. And involving them all in sustainability and making sure that everybody's working as a team for the same goal, which would be to minimise the harmful impact of what we do on the environment. Working with universities on an undergraduate and postgraduate level to foster ideas early, but also make sure that as healthcare professionals develop throughout their career, they continue to think more sustainably and to ensure that they start to develop sustainable practices early. The Centre for Sustainable Healthcare is currently supporting the development of an e-learning module which is available. We want to develop that. It is a resource where healthcare professionals can learn about sustainability in healthcare in general, and also how it applies to dentistry. And current literature and research is being updated into the module. The Centre for Sustainable Healthcare also supports a scholar and fellowship programme, which Darshini and I are part of, to give us the time to understand, research, disseminate information about sustainability, to network with our colleagues and to engage the profession as much as we possibly can. So this is an extremely useful benefit that we have. As we're aware, travel contributes the most, so patient and staff travel, to the dental carbon footprint. Involving NHS England to consider travel optimisation when commissioning new dental contracts would be hugely valuable. So looking at where services are available for patients to minimise the amount of travel and therefore the environmental impact of coming to the dental practice, decentralising services, so making dental practices more locally available, especially in rural areas, could potentially benefit. Also making sure that healthcare services and dental practices are available by public transport so that using a car isn't the only resort. Combining services such as GP with dental services to also potentially reduce the travel frequency so a patient can access multiple services at the same time. Public Health England can also have a very influential role in increasing the understanding and awareness and delivering change in a sustainable way. They could support research and guidance to increase the understanding for our health and dental care profession, and also deliver important information about prevention, which is actually one of the pillars of sustainability, to make sure that we are delivering our service but also encouraging prevention of disease rather than just treatment, which can go a huge way in increasing the sustainability of our services. Mapping our sustainability, so mapping our carbon footprint and carbon impact, as well as looking at the cost effectiveness of making sustainable changes, could also be a very useful way of Public Health England delivering the message of sustainability. The dental carbon footprint calculation study that we have referred to in this presentation was the first of its kind. However, looking into the future, this national carbon modelling could be repeated and could benefit from the support of Public Health England. This could run, for example, on a 2-year basis, in line with the Sustainable Development Unit of the NHS, which do their own national carbon calculation. Public Health England can also support the commissioning of sustainable dental services and also the development of those tools and resources that are much needed at the moment. Also putting sustainability on the agenda of the General Dental Council, who may be able to consider putting this on the standards for the dental team when revisions of this are carried out in the future. Public Health England can also work on the procurement of goods and services for dental health professionals, so encouraging them to include statements on carbon reduction and sustainability within NHS dental contracts when reforms happen in the future. Encouragement for the industry, so manufacturers of goods and services, making sure that they have sustainable policies and statements in place, making sure that they're looking at ways of producing sustainably, as well as producing goods that are sustainable. Prevention rather than treatment will also potentially influence how many goods and services are used, so better use of services if there is a higher drive and adaptation of prevention and prevention-based practices. And in partnership with NHS England, work with those who measure and monitor finances within healthcare, making sure that money is being used efficiently and the use of resources and these goods and services is optimal, and to make sure that software firms, healthcare organisations and dentists agree standards around shadow carbon accounting. If you'd like any more information to find out about what we do, as well as about sustainability in healthcare and in dentistry, please visit the Centre for Sustainable Healthcare's website. The link is available for you here. And if you have any further questions or would like to get in touch, the email for Brett is also available. Thank you for listening.